We're going to talk now to the co-founder and chairman of Moderna, Noubar Afeyan. Mr. Afeyan, thank you for joining us this morning. So phase 3 starts today. If all goes well, when will we know if it works, and how long will it take to get to market?
Good morning, George. Thanks for having me. So the plan is to start enrolling this morning, and this will continue over the next couple of months. And we have very strong demand of folks who volunteered to participate. We all want to have these answers. Thereafter, we'll collect the data. We have a certain number of cases that we need to see in the trial before we can demonstrate whether the vaccine arm gives us a more protection than folks who are not on the vaccine arm of the trial. And then it's really up to the FDA to ensure that all the safety and efficacy measures have been met before they can allow the vaccine to be broadly distributed.
So we're talking next year at the earliest?
We're talking late this year, next year, before the FDA can make this adjudication. It will depend, George, somewhat on how rapidly cases emerge in our trial, and it's difficult to predict. Hearing all of the intensification of this virus spreading in the U.S., certainly we will be doing the tests in areas where there is a significant viral challenge so that the test can actually very quickly see whether we're giving the protection. So it could go quicker, but it could also take a little bit longer. And
is the goal for this vaccine to actually prevent people from getting the coronavirus, or will it just decrease the harm?
We are very interested in being able to get the answer to that as well. Vaccines certainly can protect against getting the virus altogether. There is data that is emerging, and we'll have more to say about that demonstrates in various quite relevant animal models the kind of prevention that we'd like to see altogether. But only in a large trial will we be able to know whether one gets a little bit of the infection and then the body's immune system shuts it down the same way as someone who already has seen the virus might, if reinfected, be able to effectively shut it down, as we do with the flu, or else whether it's going to be completely eliminated so that we get very, very little effect of the infection once vaccinated.
And finally, if the vaccine gets approved, who gets priority in the early stages, and how much will it cost?
We have not yet publicly discussed cost, but certainly everybody involved in this, we and other companies have said that the pandemic is not a time where we intend to use kind of the price as a way to do anything but increase supply. So we will certainly be in the market at a price level that allows us to ramp up our supplies and reach potentially up to 1 billion people next year. And the choice of who gets the vaccine really is something that we're relying on our partners in the U.S. and government and elsewhere to adjudicate. There certainly are more vulnerable people at certain age groups, certain comorbidities, and we intend to work with each country who wants to use our vaccine to ensure that it gets to the most vulnerable the quickest.
Mr. Afeyan, thanks for your time this morning. Good luck with the trial.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.